Hello, muscle whisperers, and welcome to Coaching to Wellness. And this is how to treat neck conditions. When working with clients presenting with frozen shoulder, thoracic outlet syndrome, or pectoralis dysfunction, it's important to remember that neck involvement is often because of a cause and a symptom of these conditions. Our primary goal in this session are to restore mobility, reduce muscular compression on the neurovascular structures, and improve functional movement patterns. But first, let's talk about the anatomical connections. The pectoralis minor, which originates on the ribs and attaches to coracoid process, can become shortened, pulling the shoulder blade forward and down. This forward posture narrows the thoracic outlet space where nerves and blood vessels pass between the neck and arm. When combined with overactive upper traps and scalene muscles, this creates compression and dysfunction that radiates into the neck, shoulder, and arm. We'll begin by palpating the pectoralis major and minor. Look for areas of tension, tenderness, or restriction. To release these muscles, you can use static pressure followed by cross fiber friction. Work from the sternum and clavicle region out toward the shoulder for pec major and deep under the collarbone for pec minor. Always staying mindful of clients' comfort and avoiding excessive pressure on sensitive neurovascular structures. Here I have my client moving their breast tissue so that I can focus on pec minor. So I'm just doing muscle stripping. And I do that for about 4 to 5 times. I also incorporate a pin and stretch to allow the pec minor to stretch out as much as possible to open the chest and allow proper movement. Practice each technique on the specific muscles just so you get comfortable with working on each muscle and knowing how the fibers feel. This client is also a physiotherapist assistant, so she uses her arms very often. So throughout this treatment, you can see her communicating to me, letting me know where she's experiencing pain, discomfort, and where she had been experiencing pain and discomfort before. She presented with frozen shoulder, a forward head posture, and medially rotated shoulders or rounded shoulders. It's important for us to be very observant and take proper soap notes because many times our client come in and they sometimes don't tell us everything, just as she is a therapist and she didn't tell me everything until she got on the table. The subclavius muscle, though it's very small, plays a key role in the shoulder positioning. Palpate gently under the clavicle for the sternum toward the shoulder using slow, deliberate pressure to release any adhesions. This helps restore clavicular movement, which is essential for full shoulder range of motion. We'll address the scalenes and the SCM. The anterior and middle scalenes located on the side of the neck are very common contributors to thoracic outlet symptoms. We can do a gentle pin and stretch, work well for this. So we'll stabilize the muscle belly, then guide the head into a lateral flexion away from the side you're working on. This elongates the fibers and reduces tension. After palpating the scalene muscles, I can tell which scalene needed a little bit more attention, and that was the middle scalene. So it originates at the transverse process of the second to the seventh cervical vertebrae and inserts at the superior surface of the first rib. After releasing anterior structures, shift your attention to the posterior chain, to the levator scapula, upper trapezius, and cervical paraspinals. Apply myofascial release along the neck and upper back. Then incorporate gentle mobilization of the cervical spine to encourage balanced alignment. Finally, integrate active movement. Guide the client through controlled neck rotations, chin tucks, gentle thoracic extension drills. Encourage them to maintain open chest posture and proper scapular positioning during daily activities. By combining targeted soft tissue release with mobility training, we not only reduce pain and dysfunction in the neck, but also create a more functional environment for shoulder healing and overall upper body performance.